Hello, my name is Cheryl Yankee. I'm the microbiology manager here at St. Joe's. I'd like to talk to you today about blood culture and microbiology collection, but want to apologize in advance. I'm a new WebEx user, so the video and audio transitions may not be totally smooth. So at St. Joe's, we use the BACTEC system for blood culture collection. In the BACTEC system, an adult set of blood cultures consists of a blue aerobic bottle and a purple anaerobic bottle. Typically, in an adult, we draw two sets of blood cultures. And when drawing blood cultures, the blue aerobic bottle should always be drawn first. And we'll talk about the reason for that a little bit later. In pediatric patients, a blood culture set consists of a single pink bottle. And actually in pediatric patients, we usually only draw a single set of blood cultures. When you're drawing blood cultures, always check the expiration dates on the bottle before you draw. If they're expired or if the top is in any way damaged, please discard those bottles. Also, if at any point you can't get a hold of the bottles, they come from supply chain, but sometimes on weekends and afternoons they're busy. If you can't get the bottles, call the lab. We can always tube you up a set of bottles for blood culture collection. Just so you know a little bit about the blood culture system, organisms are detected by detecting carbon dioxide that's produced when the organisms grow in the culture media. Actually, when CO2 is produced, it activates a fluorescent dye that's in the disc in the bottom of the bottle. The instrument scans the bottles every 10 minutes and looks for a significant level of red fluorescence. When that fluorescence is detected, the instrument gives us a visual and audible clue that we have a positive. We pull the bottle, we do a gram stain, we culture it to agar plates, and we also set up a molecular PCR test called a BioFire. And the BioFire blood culture panel can actually detect 33 agents of sepsis and 10 resistance markers. So in about 65 minutes after we pulled a blood culture bottle from the instrument, we usually have an ID and sometimes a little bit of information on the susceptibility properties of that organism. Here at St. Joe's, we worked extensively with Becton Dickinson, our blood culture manufacturer, to try and reduce our contamination rate. And we found that pre-cleaning the patient's arm with either a baby wipe or soap and water dramatically decreases the bacterial burden and also decreases the contamination rate. So we ask you to pre-clean the patient's arm before starting the skin antisepsis. The choice to use a baby wipe or soap and water is up to you, whatever is most convenient. Either works very well. So in the next slide, there'll be an 8-minute video on peripheral blood culture collection. We'll have you watch that, and then we'll discuss blood culture collection in a little more detail.
See a demonstration of best practices for blood culture collection. Anyone involved in this task should know how critical it is. Adhering to protocol reduces the chance of lab errors and promotes accurate results. By following the correct procedure, you can protect your patient as well as yourself. This demonstration shows you how to perform venipuncture, which is the recommended technique for blood collection. Arterial and catheter blood collection methods are occasionally necessary, but generally not recommended. So let's get started. The first step is to check the clinician's orders to ensure you have the correct culture media and blood collection tubes. Then gather all the supplies you'll need for the collection procedure, including gloves, tourniquet, skin disinfectant, safe blood collection and transfer devices, appropriate sets of blood culture vials, and sample identification labels. Please note, labels should never be applied to the collection vials until after blood collection is completed. Then visually inspect the vials to make sure there are no cracks or signs of contamination, such as excessive cloudiness. Check the expiration date as well. Finally, be sure the sharps collector is within easy reach. Greet the patient and introduce yourself in a friendly and professional way. Verify that the patient's ID matches the information on the request sheet. ask the patient to spell his or her surname and confirm the date of birth. If the patient is unable to speak, verify his or her identity according to your institutional protocol. Needless to say, patient misidentification can have tragic consequences. Then, wash your hands thoroughly and don gloves. The optimal amount of blood to collect and the acceptable fill range are clearly printed on the BD Bactec vials. It's a good idea to mark the optimal fill volume on each vial to make sure you fill them correctly. Remove the cap from each vial and disinfect the septum with a 70% alcohol swab. Allow to air dry. Apply the tourniquet and select the venipuncture site or vein. Release the tourniquet. Carefully disinfecting the site is a critical step because even a single surviving microorganism can potentially contaminate the blood culture, so it's important to be thorough. For best results, it's recommended that you use a chlorhexidine gluconate solution, such as the ChloraPrep FREP. Gently press the applicator against the treatment site until it is noticeably visible on the skin. Once solution is visible on the skin, use gentle back and forth strokes to prep the site. Make sure to follow the manufacturer's instructions for site preparation and antiseptic requirements. Once the site is disinfected, make sure to allow the area to air dry completely before continuing. This is critical to ensure complete decontamination of the skin. Do not touch the site again. If additional palpitation is necessary, you will have to completely disinfect the site once again. The safest way to collect blood is using a closed evacuated system, such as a winged blood collection set, preferably one that enables the clinician to activate the safety mechanism with one hand while the needle is still inside the patient's vein, such as the BD Vacutainer push-button blood collection set. When using sets of vials, it's important to collect the aerobic vial first, then the anaerobic vial. Apply the tourniquet. Insert the needle in the vein and look for the presence of blood in the chamber. Inoculate the aerobic vial by pressing the blood collection device down onto the vial neck so that the inner needle pierces the septum. A vacuum in the vial can cause it to exceed the optimal fill volume, so you should monitor the volume of blood as it's being collected. To monitor accurately, the vial must be kept upright. When the maximum fill mark is reached, remove the vial from the blood collection device and gently mix the contents. Then, repeat the procedure with the anaerobic vial. Once the vials have been filled, you can continue to use the same blood collection device to inoculate any additional tubes. Handle the tubes according to the manufacturer's recommendations. Release and remove the tourniquet if this was not done during the collection process. If the safety device you're using is a push-button system, depress the button to retract the needle while it is still in the vein. If the device you're using has a sliding needle protection shield, withdraw the needle and push the safety shield forward until it's locked in place. When the needle has been removed, place and hold a sterile gauze over the puncture site. Bandage the arm. Dispose of all contaminated sharps in an appropriate disposal container and other contaminated material in appropriate disposal containers. It's a best practice to decontaminate the septum of each vial after inoculation using an alcohol swab. Clean up any spillage from the outsides of the vials as well. Remove gloves appropriately and wash your hands. Children and other patients with fragile veins may require the use of a needle and syringe for blood collection. In these instances, the recommended safe procedure is to use a needle with a safety shield. When the correct volume of blood is collected, the needle should be disposed of. A BD Vacutainer blood transfer device is then attached to the syringe to transfer the blood safely, avoiding the risk of a needle stick or contamination. As with the closed collection system, the aerobic vial should be inoculated first when using the BD Vacutainer blood transfer device and syringe. It's especially important to inoculate the aerobic vial first, as an air bubble may sit in the top of the syringe. Monitor the volume collected and stop inoculation when the maximum fill mark is reached. Then, repeat the procedure with the anaerobic vial. As noted earlier, vials should always be labeled immediately after blood collection. As with all specimens sent to the lab, labels should include the patient's name and any required identification information. The date and time of the blood collection must always be noted on the labels. Follow your institution's specific patient identification guidelines and requisition criteria. It is critically important to label everything clearly and avoid mistakes, such as writing on a label or sticking an additional label over the original or on the bottom of the vial. Any confusion or uncertainty about blood samples in the lab can compromise a patient's treatment and health. Inoculated vials must be carefully packaged for safe transport to the laboratory. They should be shipped as soon as possible and preferably at room temperature. Blood culture vials must always be shipped in a container that will prevent them from dropping or knocking against each other to minimize the risk of damage. Be sure to securely package blood culture vials when samples are sent through a pneumatic tube system. When blood cultures need to be transported from satellite locations to the microbiology lab or over greater distances, shipping containers need to be compliant with UN 3373 requirements. This means the container must have a sturdy outer package, primary and secondary watertight inner receptacles, and enough absorbent material between the primary and secondary receptacles to absorb the entire volume of liquid in the event the packaging fails. Best practices dictate that regardless of how they're transported, blood cultures should be entered into blood culture instruments as soon as possible to shorten the time to detection, allowing earlier identification and susceptibility testing. Furthermore, delays in loading blood culture vials into the lab's analytic system can interfere with growth detection. Some delays may be unavoidable. In those instances, please follow the manufacturer's recommendations and the lab guidelines. Keep in mind, however, that the sooner a patient is treated with the right antibiotic, the better the clinical outcome. Blood collection and culturing is a critical component of healthcare and medical practice. By always following these best practices, you will be safeguarding your institution and helping your patients get the best treatment as quickly as possible.
Okay, so in the video, we just saw what we call the Vacutainer direct draw method. Again, as you saw, the Vacutainer holder is attached to a butterfly. Bottle tops are cleaned with 70% alcohol. The maximum fill level is marked using the 5 ml graduations on the label. We perform the skin antisepsis, perform the venipuncture, then again, using the vacuum in the bottles, start to fill the bottles aerobic first, followed by the anaerobic. And again, I do want to note that when you're filling the bottles, use those graduations on the label. The vacuum in those bottles are not calibrated in any way, and the blood will fill totally up to the neck of the patient. That's very bad for blood cultures because then the ratio of blood to broth is not correct, and you can actually inhibit growth by overfilling the bottles. And also, by overfilling them, you can make the patient anemic. So we want to avoid that. After you fill both bottles, again, put pressure on the arm and discard your collection device in a sharps container. As they noted in the film, blood cultures can also be collected using a syringe. We actually prefer the direct draw Vacutainer method, mainly because there are less connects and disconnects. Every time you make a connection, there's potential for contamination. So with the direct draw method, there's a minimum number of connections. If you do need to draw with a syringe, you're going to want to attach a butterfly to a 20 ml syringe for the adult draw. Again, wipe your bottle tops off, disinfect your skin, perform your venipuncture. And again, very key in the syringe technique is to safely transfer the blood to the Bactec bottles. And that's done using the blood transfer device. I really encourage you to do that because in the past we saw a large number of needle sticks with the direct inoculation into the bottles using a syringe. And that's because the rubber septum on that bottle is really very, very thick. If for some reason you don't have a blood transfer device on the floor, again, call the lab and we can send them to you. Again, with a syringe draw, you're going to actually use the graduations on the barrel of the syringe to monitor your volume of fill into the bottles. And again, after your skin antisepsis, put pressure on the site and bandage it. In the video, you saw the ChloraPrep sponge. We do not have the sponge here at St. Joe's. We actually have a ChloraPrep swab, but the principle is the same. You use a back and forth friction scrub to clean the patient's skin. You want to scrub for 30 seconds and then allow that to air dry. ChloraPrep can cause irritation or some other side effects in infants less than 2 months of age. So if you're going to work in nursery or peds or NICU and you have to draw a blood culture on an infant less than 2 months of age, we actually have a protocol where we use iodine and alcohol to clean the skin. Again, very key in drawing the blood cultures is wiping the bottle tops with 70% alcohol. They're clean under the cap on the bottles, but not sterile, so you do need to clean. And we recommend you use 1 pad per bottle. And again, let those bottle tops dry before you do your fill. We do monitor blood culture contamination rates. It's required by the Joint Commission and by the College of American Pathologists. We currently have no way to track contamination rates by an individual nurse or phlebotomist, so they're reported by unit. And the current goal is to have less than 3% of all blood cultures drawn be contaminated. And by contaminated blood culture, we actually mean one that has skin flora in it. So it could be a coag-negative staph, a micrococcus species, a gram-positive bacillus, we call it diphtheroid. It also could be common hospital environmental organisms like bacillus species or our good old gram-negative friend Acinetobacter. We try and avoid contamination because it has some negative effects. First of all, if you have contaminated blood cultures and the physician's not sure of the significance, he often orders redraws on the patient. So the patient's going to get a couple extra sticks. That causes trauma to the patient. Generally, when blood cultures are redrawn, the physician will wait 24 to 48 hours to make sure they're negative before possibly discharging the patient. So that can increase length of stay. Contaminated blood cultures are also well documented to cause use of unnecessary antibiotics, especially vancomycin. That's how we get our good friends of MRSAs and VREs. It can also result in orders of extra lab tests. And again, the longer the patient's in the hospital, they can develop other complications. There have also been a number of studies that say one contaminated blood culture adds between $5,000 and $10,000 to the cost of a patient's stay. And if you look at the number of blood cultures drawn in a typical institution like St. Joe's, that would actually add between $1 and $2 million to the cost of blood cultures every year. When drawing blood cultures, the volume of blood drawn is the most important factor for recovery. We need a total of 30 to 40 mils of blood to accurately diagnose sepsis in a patient. Again, if you're doing the direct draw or Vacutainer method, you need to carefully monitor that fill level using the graduations on the label. And I do actually encourage you to make those marks because it's very, very easy to overdraw if you don't. And again, catheter and central line draws, we try and avoid because they're more likely to be contaminated than a peripheral draw. So here at St. Joe's, we only do catheter central line draws with physician order. Actually, the manufacturers made it easy for us in terms of remembering the volume of blood to add to the bottles. They actually have it written right on the label. So in small black letters, there's an acceptable blood culture volume. And for aerobic and anaerobic bottles, that's 3 to 10 mils per bottle. But there's also in big red letters an optimal volume of blood, and that's 8 to 10 mils in both the aerobic and anaerobic bottles. And the reason that's the optimal volume is because it's the best ratio of, again, blood to broth. And you have to remember in adults, when they go septic, you often have one to 100 organisms per mil, which is a very low concentration. So you need a large volume of blood to actually recover organisms. It's a little easier in pediatric patients. The volume of draw on the PEDS bottle is 0.5 to 5 mils. The reason you need less in a pediatric patient is because when they go septic, they usually have a higher concentration of organisms in their blood. They're usually more between 1,000 and 10,000 organisms per mil. So much easier to recover the organisms because of the higher concentration. If you do work in NICU, often 0.5 mils is difficult to obtain on very small infants. So microbiology will attempt the blood culture if the NICU blood culture looks blood tinged. We prefer the 0.5 mils, but we will take it with a lesser volume. If you're doing the syringe draw, if you get 10 to 20 mils of blood, we ask that you equally split it between the aerobic and anaerobic bottles. If you only get 3 to 9 mils, we have you put the entire volume into the aerobic bottle. And the reason for that was discussed a little bit in the video. There is a little bit of effect from oxygen in the Vacutainer holder or syringe. They talked about the bubble of air. That has a very minor effect actually on most organisms. The main reason for inoculating that aerobic bottle first is because most of the organisms that we recover in sepsis are aerobic. If the blood flow stops, it's better to have the aerobic bottle. Only about 1% of positive blood cultures are due to true anaerobic organisms. So better recovery in the aerobic bottle. If you do get less than 3 mils of blood, we ask that you do a redraw. And the reason for that is you've only got probably about a 20% chance of recovering the organism if you have less than 3 mils in an adult. We prefer that redraw, but we do have an exception written into our policy. If you know you cannot redraw that bottle, we actually have you put the volume of blood in a pink pediatric bottle. And the reason we have you do that is because, again, the ratio of blood to broth is better there than it is in the aerobic bottle. Again, that's sort of a last resort. We prefer a redraw whenever possible, but the PEDS bottle on an adult will be accepted. Number and timing of blood cultures is also very important. We should draw blood cultures before antibiotics are given. For every hour that passes after the antibiotics are given, the recovery of organisms decreases by actually half. So really key to get those antibiotics, get those blood cultures before antibiotics. There are resins in the aerobic and the pediatric bottle that help neutralize antibiotics, but they're not perfect. Again, it's always better to get the blood cultures collected before those antibiotics are administered. We used to very carefully time blood cultures 15 to 30 minutes apart. We know that really doesn't improve recovery now. So when you get orders for blood culture times 2, you'll draw set 1 and set 2 sequentially. That is, you'll draw them basically back to back and be completing both sets in about 10 minutes. The main exception to that is in subacute bacterial endocarditis. When you draw blood cultures in patients with SBE, the blood cultures are actually spaced 30 to 60 minutes apart, and we usually do 3 sets of blood cultures. And the reason for that is in SBE, the organisms that cause sepsis are skin organisms. I should say the organisms that cause endocarditis are skin organisms. They're usually coag-negative staph or strep viridans. So what actually happens is those organisms form a little colony or vegetation on the heart valve, and they're continuously seeding the blood with the organism. So basically you draw those 3 blood cultures and space them far apart to prove that that organism is insistently present in the blood. with a skin contamination situation or something like a wound infection. Your your bacteremia, the presence of bacteria in the blood, is actually intermittent, where in endocarditis it's actually continuous. So we do draw those blood cultures a little more carefully and spaced apart when we're looking at possible endocarditis. For adults, we're typically going to draw 2 sets of blood cultures again. Pediatric patients, normally we draw 1 set, but if a physician does order 2 sets of blood cultures in a pediatric patient, that's appropriate. And again, in a larger pediatric patient, you'll probably actually draw the adult bottles. If you have a 16-year-old that weighs 150 pounds, you need that larger volume of blood. So order of draw is important for blood cultures. When you're drawing blood cultures with other lab work, the blood cultures are always done first. And the reason for that is because you want to draw them while the collection site is its cleanest. So draw your bloods and then you can draw any other tubes you need. Again, as we talked about, you're going to draw the aerobic bottle first because that recovers more organisms. Again, blood cultures should always be drawn by peripheral venipuncture unless a line draw is specifically ordered by the physician. And one thing we put in place about 6 years ago is a policy that if the patient has a central line, the vascular access team draws all blood cultures on that patient, even if they're peripheral draws. And the reason for that was we knew the blood cultures would be properly collected, and it also really gives the VAT team a good chance to look at the central line and make sure that everything looks good on the line in terms of infection and placement on that central line. So when the patient has central line, your job is easy. You just pick up the phone. Labeling blood cultures is important as it is for any lab work. You need to label the blood culture with the minimum of 2 patient identifiers. Again, that's patient name and date of birth. Generally for blood cultures, if they're ordered in the Epic system, you will get a lab label, and that will have the patient identifiers on there. You need to check those against the patient's armband. In addition to patient identifiers, that blood culture has to be labeled with collect date and time and collector initials. And those are 2 important pieces of information because if we get unusual organisms or a lot of contamination, we want to do a trace back and potentially look at how that blood culture was collected. So we may need to talk to you. When you're labeling the blood culture, put the label on the bottle lengthwise and do not cover the barcode on the bottle. We need that barcode to identify the bottle throughout the course of incubation in the instrument. Some blood culture do's: use hand hygiene and gloves when you're collecting the bottles. Scrub your site for 30 seconds with that CHG swab. Again, allow the CHG to air dry thoroughly. Any antiseptic or disinfectant does not work properly unless you let it dry thoroughly. Again, that may be anything from 30 seconds to maybe a full minute on a really humid day. Clean your bottle tops with 70% alcohol. Again, use 1 alcohol pad per bottle. Let that dry before you fill your bottles. Again, draw the aerobic bottle first, and always draw 2 sets from 2 separate venipunctures. Never fill 4 bottles from 1 draw. And the reason for that is because if the site is contaminated, then you'll have multiple bottles that are contaminated. So always 2 sets from 2 separate venipunctures in adults. Some blood culture don'ts. Again, don't touch a collection site after you've cleaned it. If you have to relocate the vein, use a sterile glove, or as I mentioned in the video, you can re-clean the site. Don't ever wipe or fan or blow on the prepared site. That can cause contamination. And again, don't routinely collect from a line. We prefer peripheral draws, and we only do line draws if it's ordered by the doctor. And the line draw is sort of an older phenomenon to diagnose central line associated bloodstream infections, or what we call CLABSIs. It was popular in the 70s and 80s to do one set from the line and one set peripherally. We now know that it's better to draw two sets peripherally, so that technique's not done real often. We also don't collect blood cultures at the time of IV start. Those are, again, twice as likely to be contaminated as a peripheral draw. It may seem like you're saving the patient a needle stick, but in the end, usually you aren't, because often those sets are contaminated and the patient has to be redrawn. And again, don't cover the barcodes on the bottles. Positive blood culture is a critical value. When we get a positive, we will call you as soon as we have the results from the gram stain and the BioFire. We will read the patient name, date of birth, give you the date and time of specimen collected, and then report to you what we saw in the positive blood culture. You will need to do a full readback of that result and give your name and your title. We do have to document the full readback for Joint Commission and College of American Pathologists. And please, I ask that you always give your name at the end of the report, because we do have to document that. If you forget to give it to us, we have to call you back, sorry to say. So we will be calling you with all positive blood culture results. So last but not least, I just want to show you this chart. It's a chart that's available on the units. It should be posted either in your med room or near your supply cart. And it's basically a quick reference guide for microbiology specimen collection. Because in microbiology, we're transporting viable organisms, we kind of have to give them a little help to survive outside the body. So we have a variety of different collection and transport devices. And this chart basically is an alphabetic list of our common tests, and it will show you a picture of the container that you need to use for collection and transport. Just want to note that on this chart, if you see a refrigerator, that means that the specimen needs to be kept cold after collection. All of these transport containers are stored at room temperature prior to collection, but several of them, just because of the viability of the organisms, have to be refrigerated after collection. So if you see the refrigerator, keep it cold, send it on ice, send it with a cold pack, and certainly transport as soon as possible to the lab. If you don't have this chart in your unit, call microbiology. We can get you a copy. And also know that this chart is available on the intranet under the lab department. But certainly, if you ever have any questions on collection, please call microbiology. We're happy to assist you with questions on orders and collection. Microbiology is kind of a language all of its own, so we know we have to translate from time to time. So want to thank you for your time and attention today. Again, please don't hesitate to contact us in microbiology. I have a really great crew down there, very experienced, very well versed in helping you with orders and collection. So thank you again. Want to welcome you to St. Joe's, and I'm sure I'll be talking to most of you at one time or another. Thanks again.